Hello everyone, my name is Gaurang. In this video we'll try to understand why does stroke happen in atrial fibrillation. This is an important discussion for many patients with atrial fibrillation. Again, the intention with this video is provide a reference for understanding why stroke happens in atrial fibrillation, and there is no intention to provide treatment recommendations. As discussed in my previous video, which can be found on heartexplained.com and also on YouTube, in atrial fibrillation there is a lot of chaotic activity happening in the upper chambers. Instead of electrical impulses starting at one point, there are various points in the upper chambers which are bombarding electrical impulses towards the junction box. But the junction box, which connects the upper chambers to the lower chambers electrically, does a good job of filtering most of these impulses. Nevertheless, a large number of impulses are still able to make their way through into the lower chambers at a fast and irregular rate, causing the lower chambers to go fast and irregular. As mentioned in my previous video, the normal heart works like a big dragon boat with multiple rowers in it. The person sitting in the front sets the tone for the rowers to row by making a drum beat. The drum beat is the clue for the rowers to row, and that results in an effective movement of the boat because all the rowers are rowing at the same time, responding to the drum beat. On the other hand, in atrial fibrillation, you have the same boat, but you have multiple drummers, and all these drummers are not in sync with each other. These drummers are going fast, they're going irregular, and they're completely disorganized. The people who are responsible for rowing now suddenly hear all these drum beats coming from various directions, and they don't know which drum beat to respond to. In a sense, they start going pretty fast, and also irregular and disorganized. Because they're going fast, they don't really get a chance to dig into the water and push the boat forward. They are just rowing pretty fast on the surface. In a sense, what happens is, despite the rowers going pretty fast, the boat is in a standstill because the rowers are not really digging in and pushing the boat forward. This is what happens in atrial fibrillation too. There are a lot of electrical activity happening in the upper chambers, but the electrical activity is so fast that it's not able to organize itself to a single contraction. So there are a lot of electrical activity but no contraction. What happens with that is that blood does not move as vigorously as it would in a normal heart. What happens next is the blood starts pooling in the outpouchings of the heart. Because the blood is not moving vigorously, the blood tends to stagnate. And one of the most important places where it stagnates is an outpouching of the left upper chamber called the left atrial appendage. When the blood stagnates, in some conditions, it may result in a blood clot formation. And the blood clot may travel into the left lower chamber and may get pushed into the body. And the blood clot may go anywhere. One of the places it might go to might be the brain and result in a stroke. This is one of the biggest reasons for stroke in atrial fibrillation. Thank you.